Today I'm going to explain to you what I'm going to do to help you resolve your ingrown toenail. The first step in the process is, of course, taking a history about how long you've had the ingrown toenail, whether it's been red, swollen, whether there's been any drainage, pus from the side of the nail that's been bothering you, how long that problem has been existing, and what you've done on your own to treat this. Once that's done, I can help you decide whether you need a simple course of oral antibiotics, soaks to the toe, change in your shoes, or a change in the way that you need to trim the toenail. If the toenail has been bothersome despite good measures that you've taken at home, then we need to proceed to making a decision about whether to do temporary removal of the piece of nail that's embedded in your toe, or more permanent correction of the toenail, called a matricectomy. In the first case, typically when there's been history of recent drainage from the nail, redness, or swelling of the skin around the nail border, step one, which is to remove a piece of the toenail and put you on soaks and resolve that process, is most important, and it must be done first. This procedure is called the nail avulsion. To avulse something is to pull it off. Well, we don't quite do that, but with proper surgical procedure, this is easily performed within a few minutes and it's relatively painless. Your inflammation of the toenail border would then resolve within a couple of days. After this is completed, we would then have you back for step two. Yes, another surgical procedure. This is called the matricectomy. In this procedure, the root cells, which lie just under your toenail, are cauterized to prevent recurrence of the ingrown toenail. Why isn't that done first? It can be done first if you've had no redness, no drainage, and in my evaluation, I don't believe there's inflammation in the nail border. It is not uncommon that there'll be no redness, but some swelling of the tissue, pain on exam, and during the procedure, I discover drainage. Again, that's when we must limit the procedure to the nail avulsion. I have to make a decision before we start to which way we'll go. So if it's simply been tender for a long time, but doesn't have any of those other indicators of infection, then the permanent procedure can be performed the first visit. Otherwise, the safest thing is to do procedure one and then come back and have the more permanent procedure done. In this procedure, the matricectomy, when a chemical is used to cauterize those root cells, we would not want that there in presence of infection. That's like pouring gasoline onto a fire. But by the time you heal up from the first procedure, within a week, it is safe to do the matricectomy. Following the second procedure, in general, it takes approximately 2 weeks to heal. And it's my responsibility to check your toe at that time to be sure all has healed well.